Thank you, Ram. Indeed a pleasure being here. Good afternoon, everyone. Sorry for the change. This was supposed to be the last talk, but I'll just talk about premium cataract practice. And basically, I'll be giving you the top tips that I feel which are important. And I'll be covering not just the IOLs, but also premium cataract surgery, because I think these are two things that come together. That is going on to premium cataract surgery, which could be today's world femtolaser assisted cataract surgery, and premium IOLs, which could be toric, which could be the higher monofocal plus, or which could be the trifocal toric, etc. So what we have seen over the last couple of years, when we started phacoemulsification, at that particular time there were 3 speakers on the podium and there were an equal number of audience there. So that is going back way back in 90, 91, 92, when phaco was considered to be a dangerous kind of a technique that we were doing. But over recent years, we have seen the advantages of phaco and phaco going on to the femtolaser, that it has changed the fundamental aim of cataract surgery from being a pure restorative surgery to a refractive surgery, and that is something which is very, very important. So hand in hand, what we are looking at is the marriage between the uncorrected visual acuity and the independence of glasses versus the best corrected visual acuity. So that is what has happened, that we are looking at target emetropia and giving the patient a brand new eye. So phakic glasses, as we know, started, then you went on through the monofocal, and now the question that is coming is the use of reading glasses and the freedom from glasses that is there. So we need to, in the first instance, choose our patient wisely, which obviously will be checked up. But what we have done today is that we have made OCT and specular as also dry eye management as something which is very, very important that is there. Now, the first and the foremost important thing when you are doing a marketing or something is to manage the expectations of the patient, and you need to actually tell the patient as to what it is. So first of all, for femtocataract, you have to tell them how it is better, more predictable in everybody's hand, and it is more gentle on the eye. And then when you come on to the premium IOLs, I think you have to explain. The word that we do explain is that obviously when it comes down to the counselor, they say independence of glasses, but I think you should substitute the word independence of glasses to reduce dependence on glasses, because often there could be a 0.25 or a 0.5, or there could be some readers that could be this thing. And reduced dependence is the word, not independence, which we do. You need to counsel for glare and halos, because even though the lenses have improved, things do remain, and this is something that you need to tell to the patient. Now, what is very important, I think there is 2 parts to marketing the practice, and one is in-house marketing and the second is the out-house, that is the external marketing. So counseling in-house marketing, counseling is the key, and it is mandatory counseling for all cataract patients, that they must be introduced to femtolaser assisted cataract surgery, and they must be also exposed to the premium intraocular lenses that are available. And this, you need to impart the training to the counselors and then to the patient, and then you should have videos for patients to see and understand, and providing these audiovisual tools for counseling and the basic script for the counselor. So you have to educate your counselor and you have to provide that particular thing. Now, when you're looking at premium services, there are 2 things that I said right in the beginning. Flax is something that I consider to be premium in cataract surgery today, and premium IOLs is something different. As Ram has said, they will be covering biometry, keratometry, topography, etc. I won't be covering. But in the marketing in-house thing or whatever, how to make the procedure more is to create a core femto team. So there have to be certain people who have to be core femto people. This would obviously expand. So when you're getting a new, that is something different. You must train the OT staff. You would possibly call them, ask us about femto. You can have batches, or you can say femto cataract experts. And they must grow to enjoy and believe in the technology. So they must see the surgery as to how it happens, what are the advantages of that particular thing. Now, one important thing whenever you are doing is to price the procedure right. When we bought the femtolaser, it was maybe about 8 years ago or 9 years ago, I don't remember. It was only one company, and they said that you should have a delta of 50,000 rupees over the cataract surgery for a femto. And that obviously miserably failed at that particular time, because the cataract surgeries were being done even in premium centers like us at 45, 47,000, and you are asking for a delta which is more than 100%. So you should not overprice, nor should you underprice a particular thing. That is something very, very important. The most important thing I would say is a commitment, and that commitment is that you need to decide whether this technology works or not. The surgeon or the provider needs to be sure and commit to succeed. That is something very, very important, that you have to have the journey. Now, when you are looking at the premium cataract surgery or the premium IOL, it has to be a 360-degree premium experience, because you travel in airlines, you go to a business class or you go to a first class, you have different lines from where, so you can't sell an experience like a dhaba onto if you are wanting to sell a Starbucks. So there has to be a difference in the experience that there is to be there. You need to set goals and milestones as to how many patients you will convert. So this was way back a couple of years ago when we said that we need to keep a target for doing 100 femtos in a month in Safdarjung enclave, and that is mission 100, and mission 200 was for the LASIK femto procedures that was there. Now, you have to have what is known as a net promoter score. So you are looking at the detractors that are there as to why they are unhappy with you. You have to look at the passive people, and you need to have the promoters. So your net promoter score should be above 80 to 90. And so that means that majority of the patients who go back after the procedure, they need to be interviewed, they need to be asked as to what it is and how they felt, and you need to have a net promoter score which needs to be very, very high. Now, you need to also share the success. So the thing that I showed you was 100 femtos. This was 3-4 years ago, and we crossed 552 femtos in a month, in the month of March 2022. So this has been our most exponential growth, and we have given a premium experience. Everybody is told about the femto procedure. We have priced it right. What we used to do at 50,000 is now being done at 37,000 and 47,000, 47,000 for me. So there could be a differential prices between a premium surgeon. For example, I charge 47,000 extra for a femto, and my other colleagues who may be less old and less gray hair, etc., they charge 37. So you have priced it right, and you are getting an active conversion that you are having in these particular cases. Now, let us just go back and see as regards the experience of the patient. The experience of the patient starts from the call for appointment. So you could have separate people doing that: registration, waiting area, diagnosis, surgery, counselor, and type of procedure that you have. So it is at this particular time when you see that a patient has sought an appointment, maybe you could give a teaser information to that patient, what you are looking. You are asked for cataract. These are the type of cataract surgery, an interactive kind of a thing. You have these things. The moment you step into a store or come out, you have this. So moment you book an appointment, they thank you very much for booking an appointment with Center for Sight, and you have booked for cataract. So these are information. So the patients can be given teaser information. You should have posters, kiosks, etc., brag book, etc., which is there. And you should have enormity of education tools that is there. Now, whatever are the checklist for FAQs, that needs to be told to the counselor, and that counselor should not fall back on giving this. That is something very, very important. Recorded voiceover is something very, very important. When somebody is calling you or waiting, etc., you could be promoting your premium IOL procedures or your cataract procedure. Did you know that freedom from glasses is now a possibility? Cataract procedures can now be a day procedure. Regain your youthful vision by LASIK, multifocal, etc. So these could be voiceover recordings that is there. Testimonials and information letter is something which is very, very important. A thank you card, a patient feedback form, something that you can give, and obviously look at the net promoter score and the patient satisfaction letter. These are something which is very, very important. And information letter is also, and you should have a follow-up of the patient 3 months also down the line. That is what you have. One thing which is very, very important, whenever you're selling a premium procedure, you should always under promise and over deliver. You should not be categorical that this will give you independence from glasses, or that this is the panacea for all ills of cataract, etc. It should be a realistic kind of a thing. You should promise something, but it should be over delivered. That is what I feel is going to be the success for Mantra. It is outside my purview to talk about digital marketing and all those things, but that has to be also a part of the external marketing. But the 5 pillars for premium procedure is great patient selection and counseling, planning, which is biometry, precision with technology, premium experience. Do not undermine this. You have to have separate discharge cards so that the patients can kind of come through with a shorter line. And finally, promise less and deliver more. So these are, I would say, the 5 P's or the pillars, I would say, for premium procedures that you have to give to the patient. So with this, I will wish to thank you very much that whenever you are going or committing yourself for a premium procedure, you must understand and you must promise and you must over-deliver. So thank you very much for your kind attention. Thank you.
Thank you so much, Dr. Mahipal, for this comprehensive coverage. While Dr. Partha is hooking up, just a query to you. You know, we have a mixed bag of audience. You can go there. No, go there.
You can go there. Partha, you can
no, there. I have hooked on there.
No? Achha. Okay, come. Sorry.
So, do you think this premium intraocular lenses, premium cataract surgery is essentially for premium centers in big cities, or even in tier 3, tier 4 cities and towns, it is possible to do it in small single practices? You have your practice spread across multiple centers, metropolitan cities and small towns. Is it possible? How is your...
So Ram, I think you have raised a very, very pertinent thing, and I think those who are sitting here, please do not undermine your own self. People who may be from tier 2, tier 3 cities, there are patients who come to me wearing chappals. You could never think that they have, and they are actually the most convinced that I mujhe femto or trifocal lens karwana hai. So never underestimate a patient. That's what I said, that there has to be an introduction of the technique and the technology to all the patients irrespective. So today is my advice to any patient says flax/MICS. Zero patient would just have phaco written on it. It will be flax/MICS. Let them be introduced to the procedure. You can tell them about trifocal also, and there are, so for example, people feel that if you don't have a Callisto or you don't have a Varion, you shouldn't do a toric. I think that's misinformation, underestimating the power of the doctor, because these are things that if a person has an astigmatism more than one diopter, you should not miss out, because the patient will be very happy getting a toric lens. So you have to, whether you are in tier 2, tier 3 cities, give the options. The only thing which you may not be able to do is to upscale this thing. You can have Indian toric lenses which are very good. You can have Indian trifocal lenses. So I am one with you that each and every person who is a good surgeon and knows how to give consistent results, that's the most important thing. Your skill, your consistency in the results is going to be the hallmark. If you have the confidence and you have the skill to deliver that, please step on and go what we are calling as premium, because this is going to be standard of care tomorrow. When we started phaco, that was considered to be dangerous, then it became premium, today it is standard of care. So the goalpost is going to evolve very fast. So everyone should work on that. Even if you don't have the most expensive technology, you should work on the premium IOLs.
Thank you. Thank you, Mahipal. That's the point I wanted to emphasize. Even in our own practice, we find that it's more the middle income, the upper middle income who are more easily convinced to uptake these procedures. They're much more easier to handle, much more satisfied patients. And finally is the word of mouth which converts to more and more patients.